Hi students, let's see certain questions here. So we have finished the odontogenic tumors here, and let's see certain previously asked questions in your NEET INICT exam. So I hope you have finished seeing all the videos of your odontogenic cyst and tumors. Okay, now let's use that to see. Let's use that to work up certain questions being asked in your NEET INICT examinations. So let's come to the first question here. So this is, I think this is very familiar to you. We have discussed it more than two times in your videos. Like we have discussed syndromes as well as now we have discussed in your odontogenic cyst also. An 18-year-old patient. So this is 18-year-old patients with the ossifications of false cerebri. Okay. So I think within this itself, you got the idea that what we are talking about, ossification of false cerebri. We have seen this in her syndromes. We have seen this in our cyst. Okay, so 2 3 times it is coming repeatedly. That's why I am saying that this is so important topic areas. Okay, and multiple unilocular radiolucencies. Multiple unilocular radiolucencies, they mean that this is OKC. And in the radiograph, so you can the radiograph you can see that there is false cerebral calcifications and there is palmar plantar keratosis. You can see palmar plantar keratosis. So what is the syndrome associated? Very simple. So from the options, papillon lefevre. Now, papillon lefevre is something related to your papillon lefevre, papilla and gingiva. So it is something to your periodontium. Okay, periodontal lows and all. Okay, Gardner syndrome, there's multiple supernumerary, multiple osteomas and all. Multiple dentations is just one wrong option. Basal cell nevus syndrome. Okay, so the answer is basal cell nevus syndrome, where you see multiple OKCs, multiple OKCs can be seen, false cerebral calcification, okay, short metacarpals, and your front brachycephaly and many other conditions you can see. Okay, multiple basal cell carcinomas on the body, bifid rib you can see. Okay, so many features. So see how important that syndrome is. Okay, now here we have a question. A 35-year-old patient reported to the Department of Oral Surgery with swelling in the posterior jaw region. Biopsy was sent to the lab for the following histological picture. Okay, this is about a histological picture. What is your possible diagnosis? So in this, what you are seeing, I always, when you get a image based question, make sure it is a cyst or it is an epithelial lining. How can you identify whether it is a cystic lining or an epithelial lining? I have told you, if there is no reter edges, it means that that lining is most possibly a cystic lining. If it is an epithelial lining, you may have a reter edges. So here we have a swelling in the posterior jaw, and this is a biopsy, and you can see that there is a lumen here, and you can see this, appreciate the epithelial lining here. This is the epithelial lining, and one thing you have to make sure that how it is the thickness of the epithelial lining, how much thick that epithelial. This is this thick. The epithelial lining is anyway 6 to 8 layer or more than 2 cell layer thick. It definitely it is. So it won't be, definitely it is not a. It is not a dentigerous cyst. Okay, and the lumen is filled with some kind of pink substance. Okay, the lumen is filled with some thin substance, and that is nothing but, okay, it is your keratin. It is a keratin. Now, even if you cannot identify the keratin, you should see the lining. I am okay that identifying that keratin is difficult for us. Okay, it is only comes with experience that, okay, that is something kind of keratin. But from your knowledge, with your knowledge, okay, with what knowledge you already have, okay, I don't want any what guesswork here. With the knowledge you already have, you can see that the epithelial lining is that thick. It is not 2 to 3 layers, so you can omit dentigerous cyst. The epithelial lining does not show any kind of gosels or something. It is just a stratified epithelium which is keratinized. So it is not a calcifying odontogenic cyst. Okay, and it is not showing any kind of plaques. It is of uniform thickness. It is of uniform thickness everywhere. Okay, it is not a lateral periodontal cyst or a botryoid odontogenic cyst. Okay, lateral periodontal cyst or botryoid cyst usually show multilocalities, and you can see that there will be epithelial plaques. Okay, it is not shown here. So the best answer is odontogenic keratocyst here. Okay, because the lumen is showing lot of keratin. Okay, so that is one thing. Next one. Okay, which of the following are features of basal cell, nevoid basal cell carcinoma? See, again and again that syndrome is very important. Okay, so in the options you have, this is INICT paper, uh, calcification of false cerebri. Yeah, that is there. Definitely we know. So one is there, but all the options, all the option has one. Okay, one is there. Multiple odontogenic keratosis, yeah, very true. Yeah, 1 and 2 is there, so we can omit D. 1 only, that is not the answer. 1 and 2. So now it is between A, B, and C. Enlarged head circumference, yeah, it's there. Okay, brachycephalic head. Okay, 1, 2, and 3 is there, so I can avoid C here. Now it is between A and B. Short fourth metacarpals, yeah, it is short fourth metacarpals. We have discussed this syndrome in our videos. Okay, in the syndrome, yeah, 1, 2, 3, and 4, all the 4 answer. So option A. Okay, that's it. Now let's see a next question. Okay, this is a NEET 2022 paper. This is a NEET 2022 paper. If you answer this, I say that your preparation is very much in the right track. Okay, if you answer this question. Okay. The given image of a cyst in the mandibular region, okay, in the mandibular region, the following image, adjacent canine and first premolars are vital. So I appreciate that this is the canine here and this is the first premolar here. I am seeing a radiolucency lateral to the canine and premolar, and they are saying that the both these are vital tooth. So it's okay. They are giving a vital tooth here. So if it is a vital tooth, I can avoid option B here. It is never a radicular cyst. I am avoiding option B because option B is associated with a non-vital tooth or tooth with a pulpitis, right? Tooth with pulpitis. Okay, now I can avoid apical periodontal cyst also because that is also a tooth cyst with which is related to inflammation. Now the option D, the third one, gingival cyst. Gingival cyst will not have a radiographic finding. I can avoid that also, and answer is botryoid. And before that itself, I can come to the answer of botryoid because botryoid is a multilocular variant of lateral periodontal cyst. You know, I can see multilocularity in this, and that location is very famous for your lateral periodontal cyst. Lateral periodontal cyst, and lateral periodontal cyst is unilocular. When it comes to multilocular, it is called a botryoid odontogenic cyst. I hope that multilocularity you can appreciate that the answer is botryoid. See, when you know the concept, when you are clear with the concept, I hope you have seen the videos of lateral periodontal cyst. Please, if not, please see all the videos and then come to the question. Okay, that is the best way that you can learn and work out on this. Okay, now next question. A patient comes with a complaint of swelling in the right lower posterior region. Okay, yeah, a thick cheesy material on aspiration, with the thin epithelial lining with corrugated surface. Identify the pathology. Okay, anyway, see the radiograph. I think by reading the question itself, you got the answer because you know what is aspiration, what material is aspirated. We have studied all the cysts like that. We have studied all the cysts like lumen lining capsule, what comes in the lumen, what we aspirate from it, what is the protein content in it, and we have learned it in the best way. Okay, so you can see this cyst here, and they are saying that you have an impacted tooth associated, and you can see the cyst has a corrugated surface. See, all the features are matching up there. Okay, and thick cheesy material is aspirated. Now if thick cheesy material, it is not dentigerous cyst. In dentigerous we get a straw colored. It's not ameloblastoma, it's not a myxoma, they are tumors. We are seeing a cyst here with an impacted tooth, and the answer is OKC, and that thick cheesy material is the keratin. Okay. Okay, now next question here. A patient comes with a painless swelling in the anterior mandible. Okay, now it's an anterior mandible. And what is the diagnosis in this? Okay, so this is little tough question. This image is given. They have given no clues. But even if this is a tough question, I am sure that if you use your common sense, what you have learned from this videos, it is going to be a very easy question for you. Okay, so this question was from your NEET 2022, I think 2022 or 23. So here we have a painless swelling in the anterior mandible. Okay, anyway, it is anterior mandible. Histopathological image is given and there is no other clue. So we have to get this answer from the picture itself. Okay, so I am going to see the picture. I will zoom in for you. Okay, guys, this is the picture where I am seeing so much of, there's as an arrow denoting to the clue that I have so much of ciliated cells here, ciliated cells. and okay, some kind of hobnail cells here and ciliated cells here. It's kind of cilia. Okay, and that is there. So I am not seeing any amyloblast like cells. I mean, I am not seeing any amyloblast like cells, or I am not seeing any Wicker Golden sign in this. So it is not an amyloblastoma anyway. Follicular, does follicular amyloblastoma look like this? The follicular amyloblastoma, we learned that it is fat follicles with central or inner side they have cystic degeneration. So it is not follicular amyloblastoma. Okay, and the other thing we see is it is not OKC, not at all OKC, because OKC has 6 to 8 layers cell thick. Okay, and radicular cyst, if you see the video of radicular cyst, it is there in the section of our periapical lesions. Okay, radicular cyst will have stratified epithelial lining with the it is non-keratinized stratified lining with the what so much of connective tissue entrapment and so much of lymphocyte inflammatory cells in the connective tissue. This connective tissue, this is a connective tissue capsule. That connective tissue capsule will be filled with lymphocytes or inflammatory cells in radicular cyst. Okay, so and they will show that arcading pattern and all. Okay, they will show a multi-layered what stratified squamous epithelium in an arcading pattern, and it has cholesterol cleft and inflammatory infiltrate, so it doesn't fit there. The best answer here is glandular odontogenic cyst, because glandular odontogenic cyst show features of the cilia. Okay, hobnail cells. Okay, and sometimes you see duct like, gland like, or duct like structures. Okay, so that cilia is that ciliated epithelium is the clinical clue for here. Sorry, the histological clue here to come to the diagnosis of a glandular odontogenic. Okay, now coming to the next one. Okay, here. In ameloblastoma, there is unicystic, multilocular, anatomically benign, clinically persistent, blah 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 is given to waste your time. Okay, this is a neat examination paper. All these cells is given to waste your time. Okay, you will read it. Identify the lesion. Okay, which is this type of ameloblastoma? They are given follicular plexiform. It's not flexiform. It is plexiform follicular clear cell acanthomatous. Okay, so what you are seeing, just look at the image and you have to identify the what type of ameloblastoma here. Okay, so what I am seeing is that I am seeing a follicle here. I am seeing a big follicle here, and I see some cystic spaces inside that follicle. Okay, so I have a big follicle here and I am seeing spaces inside the follicle. Now, from this clue, you can easily say that what type of ameloblastoma it is. Okay, so it is a follicular type of ameloblastoma. So follicular ameloblastoma show fat follicles with the central degeneration. Okay, then okay, see, a patient comes to the clinic with the following radiograph with the radiopacity surrounded by a radiolucent rim. Now, what is this diagnosis? See, this is a very important question. In 2022, this question was asked in both NEET and INICET on the same in the same year. In the same year, same picture they were asked. Okay, exact the ditto picture, because I have written the both exams, and I was surprised to see that the picture we used to discuss in the class, okay, discuss in our lectures, that picture as asked as a question in the paper. Okay, so the patient is coming to you with the this radiograph. Okay, you can see that radio opacity is attached to the tooth, and that radiolucent rim is surrounding it, and it's a classical radiographic picture of your cementoblastoma, right? Cementoblastoma. And you are familiar with the radiographs of odontoma, condensing osteitis, hypercementosis, etc. Okay. Yeah, if you answer this, you are fit for the NEET examinations. Okay, you will not be afraid of any of the H&E pictures. This is a NEET 2023 latest paper. Okay, and can you see what is this cyst? What is this lesion? So we have options here. Okay, we have options here: COC, dentigerous cyst, OKC, and radicular cyst. Pathology in the image. And I just want you to identify exactly one pathology here. The straight to the pathology, straight to the clue. There lies the answer. It closes the chapter, right? So what you are appreciating here, you are appreciating these things here. So you can see a lining, and you can see a lumen, you can see a lining, and you can see in the lining you have certain pinkish structures which lack nucleus. There is only cytoplasm there, only pinkish cytoplasm. They don't have any nucleus. Okay, that is ghost cells. Ghost cells. So you identify ghost cells. Your only motto is to identify the ghost cells and then come to the answer. It is calcifying odontogenic COC. See how simple the questions are. Yeah, there is one more question here. CEOT like areas. Okay, INICET paper. INICET paper. CEOT like areas are seen in. So CEOT like areas are seen in. They will give you options like CEO. See, this is the option D. CEOT. Okay, CEOT like areas are seen in. We have discussed in our video in AOT that COT like areas are seen in AOT. If you are not seen the video of AOT, please revise, see it again. The 6 histological features you see in the AOT, okay, the cell-rich nodules, the hyaline ring, okay, the microcystic structures, okay, the rosette pattern, convoluted double row pattern, CEOT like areas, okay. Please go and see that question, okay. And next one, okay, the odontogenic tumor added by WHO 2022 classification. Okay, 2022 classification, which was added in the WHO classification. Very simple. In our first introductory video, we have discussed about the classification of odontogenic cyst and tumors. Okay, that is adenoid ameloblastoma. Okay, adenoid ameloblastoma. Cemento-ossifying fibroma was added in the year 2017. In 2017 classification, cemento-ossifying fibroma and primordial odontogenic tumor (POT) was added. Right. In 2022, your adenoid ameloblastoma was added. Okay, 2022. Okay, this is one and last question. Hyaline rings are seen in hyaline rings. Very simple. Our adenomatoid odontogenic tumor, hyaline ring or tumor droplets, hyaline droplets, all these are seen in your AOT. Okay, I hope this is clear to you. So this is how they ask question in odontogenic tumors, and I hope you are thorough with AOT, thorough with odontogenic, all the odontogenic tumors. Okay, so see you in the next video with a new topic. Bye.